A patient tried to remove earwax using a sharp object. No history of ear discharge, trauma or infection before the incident. No systemic complaints like fever or dizziness. This is the history of this case. So now let's see the complaints. He having no pain at the wrist, mild discomfort only while sneezing or any yawning, and hearing is completely normal. So he didn't feel anything and don't have major complaint. But on examination, otoscopy findings: tympanic membrane intact but slightly congested, and a small bleeding spot seen at 4 o'clock position, anterior-inferior quadrant में. No perforation or pus is seen. So this is to remember that even a small mistake while clearing a ear can injure the eardrum. So never use a sharp object. Your ear cleans itself naturally. Stay aware, stay safe. Subscribe to Shiksha Pro for more medical insights. Thank you.